So what exactly is depression? It's a mood disorder that causes severe symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, or working. While it's a mood disorder, it is extremely serious. There are three main types of depression. The first kind is called persistent depressive disorder. It's a depressed mood that can last for up to 2 years, or sometimes longer. A person can experience depression and a lot of emotional episodes, but symptoms must last for 2 years to be considered a persistent depressive disorder. The second type is perinatal depression and is much more serious than the baby blues. Relatively mild depressive and anxiety symptoms that typically clear within 2 weeks after delivery that many women experience after giving birth. Women with this depression experience full-blown depression during pregnancy and extreme feelings of anxiety, which makes it difficult for new mothers to care for their children. Another type of depression is psychotic depression, and it occurs when the person has severe depression plus some form of psychosis, such as having disturbing false fixed beliefs or hallucinations. Another type is seasonal affective disorder, and is characterized by the onset of depression during winter months when there is a lack of sun. Winter depression, typically accompanied by social withdrawal, increased sleep and weight gain, predictably returns every year, but will lift during the spring. A different form of depression is also bipolar disorder, but is included in the list anyway because of the same experiences and similar symptoms of depression. Same group due to side effects and how you would experience it. But all in all, that is the overview of the types of depression.
Depression is unique for every person, but there are some telltale signs. You may be experiencing depression if you have one or several of these symptoms, and these even are all of the symptoms. These are just the major ones. So, for instance, if you ever feel empty inside, like there's nothing in the world that can help you, just a constant empty feeling, you may be experiencing depression. If you ever feel worthless, like your feelings or words go unnoticed, like there's nothing that's worth your time, you may be experiencing depression. If you ever feel pessimistic, like there's nothing going your way and you're always losing, you may be experiencing depression.
What anxiety can do to you, how it can affect your daily life, and some of the ways to cope with it. At simplest.
If you feel like you have decreased energy, like there's nothing that can get you motivated, then you may have depression. If you feel like you have a loss of your interests and there's nothing that can make you happy, you may have depression. And these are just the big ones to reiterate. So make sure that if you have any of these or just a couple of these, you may be experiencing depression, and it's important to talk with others to solve your problem.
These are the risk factors and treatment according to the National Institute of Mental Health. Depression is the most common mental disorder in the U.S., and it affects every 1 in every 8 people. Saying that is also very easy to treat and can go away after a certain amount of time and treatment. Depression can happen genetically due to biological reasons, environmental, or psychological factors. It can also happen because of weather, parents, friends, or social pressure. It also happens at any age, although it's usually in adulthood, but a child could get it or an adult person could get it. It just kind of depends on who the person is and what they're surrounded by. It also can happen when someone is experiencing death, or a sudden illness. Medication can also lead to depression. So if you're taking a medication that already is maybe not the best, or it's causing you to have suicidal, depressive thoughts, that can cause depression as well. It also is hereditary. So if a mom and a dad both maybe had depression, the child could have it as well, maybe in their later life or now. It is important to realize that everyone's depression is different. One person may be affected by depression in a different way because they may be able to hold it in more, while someone else may just show it and have very, very showing signs of depression. It's important to remember that when you're treating someone with depression, to listen because everyone's is different, and a lot of people may show their sadness in a different way, and also to encourage your friends to go see a doctor if they are feeling depressed. Medications and psychotherapy are the best way to treat depression. Talking to a counselor, psychologist, someone that's there to listen, or taking antidepressants from your doctor's orders, that is the way to go. The doctor's orders you need to follow specifically because your doctor does know how to treat your depression. Also remember that antidepressants take 2 to 4 weeks to work, so before you start jumping to conclusions or saying if that medication is or isn't for you, give it some time, and if 2 to 4 weeks, if you aren't feeling it, tell your doctor. Also, you should watch for suicidal thoughts when you are on antidepressants, because those could become prevalent if the dosage is wrong or the medication is wrong. There are different herbal treatments for depression. You can ask your doctor about this, special teas and herbs that could lead to possibly helping or changing your mood, and just bringing that up. Be active, find a hobby, get out more, meet new people. These are all great ways to help with your depression, and also talk to your doctor about maybe creating new goals, and meet new people specifically, maybe join a support group, just any way to get out and be active. It is very, very important that you get help. So see a counselor, talk to someone, create goals. That's the biggest thing. So long-term and short-term goals, and be able to visualize your goals as well. Also, like I said, join a support group, meet new people. Also surround yourselves with those who are happy, maybe don't have depression, because maybe they'll just boost your mood. And try different types of natural ways to kind of cure your depression: acupuncture, yoga, different herbs, medical marijuana. These are all different ways that you can talk to your doctor about to treat it naturally. To help a friend with depression, it is important to make sure that they are happy and that they are stable. Things you can do is talk to them, walk with them, find an activity that you enjoy, and overall spend time with them and try to get them out of maybe a depressed stage. It is important to listen to what they are saying and not jump to conclusions, and also to take your time, because what they are saying is important and it's how they feel. Also, learn yourself. Find yourself through your journey, and listen to what other people are saying if you're depressed.